Hey, how are you?
I'm good. How are you?
I'm good. Welcome to Urgent Care Management Monthly. We're going to be talking today about doing some contracting with some insurance companies, and while that's not normally a super exciting subject, I hope we can help some people out there, because the problem I have, and I think every urgent care owner manager has, is it's kind of hard to understand if you've never done it before. So why don't we start with the basics. I just introduce you. This is Candice Smith. She's our super phenomenal billing department supervisor. How was that introduction?
Yeah, wonderful.
Right. Now she's going to want to raise. So let's start with the basics. When I'm talking about owning I'm an urgent care owner, and somebody says to me, you need to get some contracts with some insurance companies, and I say, what is that? What does that mean?
The first step in contracting. The first step in contracting is getting to know, going out into the community basically and finding out what types of insurance companies are out there. What are the most
most used ones?
Yes, the most.
So like in our area, that would be like what?
Arkansas Blue Cross.
Okay.
Definitely. Medicare.
Texas Blue Cross,
yes.
Aetna,
United Healthcare, yes.
Okay.
Which insurance companies the employers use the most.
Okay.
By doing your homework, that's the first thing you should do.
Okay.
Those are the first ones you should get contracted with.
Okay, what does that mean though? Get contracted with. What does that mean?
You're establishing a contract with them to use their insurance company in order to make money, basically.
So basically, I'm saying I'll give you these services and you pay me this amount of money.
Exactly. And we'll negotiate what types of services, how much you're going to pay me for the services based on using their particular contract in their name.
And that's where the concepts like PPO, HMO, in-network, out-of-network, all those things sort of come into play.
Those are the different plans that you can pick from.
Perfect. All right, so now it's more confusing. All right, so I've figured out that I'm going to go to Medicare, let's say, since that's nationwide and everybody has to deal with that. Mm-hmm. Now what do I do?
Now you're going to go to Medicare and you're going to get your physicians credentialed with them.
Okay.
Credential means you're going to let them know that they are real physicians, that they do that they've had their background checked.
So there's certain things they're going to require.
Exactly.
Okay.
Then you're going to start a fee schedule. With Medicare, you have no choice in your fee schedule. They tell you what they're going to pay.
Defined by them.
Right. With the other insurance companies, you can kind of play with them. You can kind of pick what you want to do based on the certain services that they have. There's urgent care levels. There's PCP levels. Of course, we want to do urgent care. Those plans are going to pay more because there's nighttime services. You have to stay open longer. You have to have a supervisor.
Higher cost.
Exactly.
So let me stop you for a second. All right, so when we first started, I was very naive, didn't know anything about any of this. Mm-hmm. So we basically went out to these insurance companies, and we were so hungry for business, they sent us a contract, we signed it.
Exactly.
Right?
Mm-hmm.
That was a huge mistake. Mm-hmm. We didn't know it was a mistake at the time. We were naive and didn't know. So I will tell you, essentially what happened to us is they would send us a contract, and usually they would say, we pay, let's say, 110% of Medicare. Mm-hmm. And we would say, we didn't know that was negotiable.
Right.
We figured it was like, going to Walmart. You take it or leave it. Mm-hmm. And so we basically would read it and say, well, this is what they pay. Should we take it or should we leave it? Right. And then we'd make a decision on that thing. But what you're saying is you don't have to take it or leave it. You can go back to them and say, no, we'll do some other things.
Right.
Okay, so tell me how would I do that?
You would go to provider relations and you would let them know, look, first thing, you want to find out what services you're going to do the most, because that's going to get you the most reimbursement. So you go to provider services and say, look, the girls I have keep logs. The things that they write off, if it's an S code, if it's a certain splint or something that we write off all the time because they're not participating, they don't pay for it, that's the first thing you do. Is you go to them and you say, look, we're doing a lot of these, and if you want us to renegotiate your contract next year, you'll implement this into the contract and pay us whatever you're going to pay, and then you can agree or disagree.
Okay, and what if I'm just starting my urgent care? I'm not renegotiating my contract. I'm negotiating for the first time. How do I know where to start? I have to put together a fee schedule. Mm-hmm. How do I know how to do that?
I would do my homework with the area.
Okay.
And,
see kind of you can't collaborate with another physician. That's against the law.
Right.
But you can at least try and see what national standards are, area standards are, and that kind of thing.
Maybe
and then you can put your fees based on sort of what everybody else.
And I wouldn't. The first thing I wouldn't do is sign a long contract for that either. Maybe just 6 months or maybe even a year if they allow it. Most of the time it's going to be a year, but after a year I would definitely renegotiate those, and every time they came up they need to be renegotiated based off the year's
what procedures you've done and stuff. Now let me ask you this. So we're in the process of renegotiating some of ours now. We're always in the process, but let's just say I'm a new urgent care owner, I've never done this before, or I've had some contracts, I'm not happy with them, and I want to renegotiate them. Is this something I should do as the owner, the physician, the practice manager? Should I hire a biller to go do that? Should I hire a consultant? What would you say is the best way to handle that?
Consultants, I like to hire consultants because it's lots of paperwork and it's time sensitive. So if you don't get that stuff in and you don't get the proper signatures on stuff to even negotiate it, then you have to wait till the following year. So I would definitely hire. There's consultants that'll keep up with that paperwork and at least keep the time, the time stamp on it and which day it needs to be done, what signatures, and they send them to you. And then I would definitely, within the clinic or within the organization, have a meeting about that and get that taken care of. Okay. We do have other. There are some outside sources that help, and they negotiate those and do.
Because there's some billing companies, like we'll say. Like one of the billing companies we used to use, they said they would negotiate our contracts for us. The problem we had is they never did.
Right.
They just re-signed everything essentially. And I didn't feel like they negotiated much.
Right, and that's what the outside sources are doing. They're not necessarily negotiating. They're getting your paperwork together and getting it ready for you to negotiate. And because some insurance companies won't negotiate with third parties. They won't even let them get it together.
So some of the consultants, sometimes you can't hire a consultant, you have to do it yourself.
Sometimes
my guess is they do that so that you don't know what you're doing and they can take advantage of that.
Exactly, okay. They can get percentage.
One of the things I think we're focusing on right now is it's so hard to determine what's going to happen with Medicare in the future, and so many of the contracts are based on a percent of Medicare. I'm actually trying to negotiate not having our contracts based on a percent of Medicare because it's so, it's unclear what's going to happen to that program, and it doesn't seem like our contract should be negotiated based on a percent of something we can't control. Was that what you'd recommend to do, or how would you do that?
No, because everybody's going to negotiate with Medicare. Medicare is the top dog in this industry. Right. So, you can fight for it, and sometimes if it's not a need in that area, or if it's a type of insurance company that may not go by Medicare rules, everyone goes.
Because the problem we've had in the past is we have, say we get a contract 110% of Medicare, and Medicare cuts their fees by 30%. Well, guess what? We just got our fees cut by 30%, even though we did not have a Medicare contract.
But I think some clinics and organizations, I think what they don't know is that every year, just like you go to Walmart and they raise their prices to fit the standard or the living cost of what goes up, you can do that also, because it should be done yearly, I think, because that
so your cost of services are more, you got to pay my nurses more,
most of the time the insurance companies are paying 80% of the bill charge. So if your charge is $1,000, and it's customary and reasonable, they will pay it, and they're only going to pay. Or if you have a set fee, some of them go by a set fee schedule they put in and you but most of them will pay you 80% of bill charges. So.
Let's talk a little bit about charges that you can negotiate with insurance companies that are unique to urgent care. Everybody's confused about an S code. Can you explain what an S code is?
The S code is on the claim to let the insurance company know that it was done at an urgent care. Right. So when it goes to the processor at the insurance company, they write off that code's on there. They know, okay, this needs to be processed under the urgent care benefits. Right. It's not to penalize the patient. Some insurances pay for it and some don't. Right. If they don't pay for it, or it's not allowed, we don't charge the patient for it. But if it's allowed, then it is a percentage of what the patient needs.
So it was essentially a code approved by Medicare, approved by the government, I should say, as a legitimate code that we can use and put on the chart to say, because we're an urgent care center, because we're open late, because we have extra staff, etc., we're allowed to charge this charge. Is that right? Okay. Yes. What other kinds of things are unique to urgent care coding or billing, I should say, that we can negotiate with an insurance company?
There's an after-hour code that actually goes on there. If it's a weekend or if it's after 6 o'clock, I think you can add that code to it. Okay. There's different modifiers that can be added. Lots of things.
Okay. Yeah. And there's an emergency code also, right? Like if I thought at least there is a code that basically says we had to stop the whole clinic because this whole emergent procedure happened.
If there's one.
Yeah, that's what I mean. If something like that were to happen. Okay. Good. So back to me being brand new. Brand new. I've never done this before. I don't know exactly what I'm doing. I kind of have some ideas. You're me. What would you do?
And with getting
getting my contracts, what would be the best way? Should I hire somebody to help me?
Mm-hmm,
That's probably the best way to do it.
Definitely hire someone to help you first off, and then get all of your contracts together. Get a copy. Always have a copy of your contract on file. That way you can always refer back to it the last year. Mm-hmm. Always have your girls, if there's any write-offs, any adjustments because of the contract, keep them documented. Okay. Because when you go to negotiate with them, you can say, I wrote this off 1,000 times this year, and Cigna pays for it. And we do lots of business with Cigna, and we want to keep our business with you, but we want you to see if you can adjust that code for us and pay it.
Okay. Definitely. One last thing I would say as an urgent care owner, one of the experiences we had that was surprising, but it was a good lesson to learn, is we had a company who used a certain payer, and the payer would not negotiate with us. They said, this is our rate, take it or leave it, and it was not a fair rate. And so I actually called the employer. It's a big employer, and they love us, and I called him, their owner, and said, hey, sorry, we're not going to be able to see your employees anymore. And he said, why? And I explained it to him. He hung up the phone. 2 hours later, the insurance company was calling me, saying they want to negotiate the rates. So sometimes there's a bigger hammer on the end of the person paying the bill than there is on our end, where we're putting out our hand trying to collect the money. Just a nice little tip for people to know out there.
That's another reason why you get somebody else to help you, and you within your billing company, you find out what the little nicks and knacks are for that type of stuff, and get that.
And how often should you renegotiate?
Every year.
Every year.
Possible.
Okay, good. Any other tips, advice? Jokes?
No.
That it?
Yes.
All right. Thanks for coming.
Thank you.
Appreciate it.